Hi everybody, we have a great show today. I want to thank you for joining me today. We had some technical glitches, so let me know if you were able to watch this on Facebook and on YouTube. I need to make sure that the technology is working, but today we have a great show. We're going to talk about, is your IBS causing you to be fatigued and tired? We'll talk about, are diet pills safe? And we'll talk about, is drinking Bulletproof coffee good for you? And would me as a GI doctor recommend this for my patients as well? Guys, let's talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right, I want to thank you for joining me tonight. We have a great show tonight. I know that if you're here locally, there is a big game going on. And so I know that we may not have as many people here, but as a Longhorn fan, go UT! I hope that UT wins the game tonight. Don't hate me for that. But if you're joining me for the first time, my name is Dr. Islam, and yes, I'm an actual poop doctor. Every other Tuesday, I go live to answer your questions you guys may have. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And also, let me know if you're watching this live or on the replay, and also let me know where you're watching this at. I love to hear where my audience is from. Hope you guys have a great day, a great January. It is going to be cold here locally in Lubbock, and I know that it's supposed to snow, so I hope you guys are staying safe. We have a great show tonight. 3 main questions we're going to answer, and any questions you guys have live for me as well. And as usual, comment, let me know what you guys think, and also let me know where you guys are watching this from. And please let me know if you're able to see this either on YouTube and Facebook or Instagram or all the other social media channels. I want to make sure that my technology that I have right now is working. All right, first question. Hey, Dr. Islam, chronic fatigue and IBS, is there a connection? Let me know in the comments, do you suffer from irritable bowel syndrome or IBS? And have you also noticed that yourself being fatigued? Well, let me tell you, the answer to this is yes. There is a direct connection between IBS and fatigue. So the question is why? What is going on, and why do you have chronic fatigue when it comes with IBS? Well, there are about 4 or 5 different reasons why people feel so tired when it comes to IBS. So number 1, you have underlying inflammation going on inside your GI tract. We know for sure that there is inflammation going on. We know that inflammation over time can cause leaky gut and dysbiosis as well. And that chronic inflammation can make people tired all the time. Number 2 is that whenever your bowels hurt, whenever you need to go, when you have IBS, you have that pain, discomfort, that pain also makes you tired. Yes, you can be tired from physically having that pain, and that can cause a lot of issues to occur. Number 3, there is a brain-gut connection, 100%. What happens here will manifest here, and what happens here will manifest here. And that also can cause people to be tired all the time. When you're thinking about your gut all the time, and this connection here affecting here, that's going to make you tired as well. And then lastly, we have found that patients who have IBS have an abnormal growth of bad bacteria inside their GI tract. There's more inflammatory bacteria, less good guys, and we are seeing over time that degree of inflammation can lead to fatigue, allow you to be tired, and also not help out with a lot of what's going on. So if you have IBS and fatigue, what can you do to help manage this? Well, number 1, the biggest thing I would recommend is try to see if we can helpfully manage your stress. I know it's easier said than done, but stress relief for sure can really help out when it comes to IBS issues and fatigue. And there are different ways that have been shown in medical trials to help out with stress and IBS. Hypnotherapy, it works. Cognitive behavioral therapy, it works. Going for a walk, doing exercise, doing yoga, even acupuncture. These things actually work because what it does, it helps to minimize that stress. It turns off that fire inside your belly, and by doing that, you can hopefully manage the fatigue. Number 2 is that sometimes other medications that we have to help deal with stress, and your gut can also help out with fatigue. So the medications that we offer for our patients, whether it's medical options or it is natural options, will help out with stress as well. And it's very common to have that. Number 3, I want you to recognize that fatigue is part of the condition of IBS. It is very hard to deal with, but recognizing this may be an issue may help you get over it. And then lastly, exercising and getting sleep. I cannot tell you how important this is, not only for fatigue in general, but also for IBS. It works, it makes a difference, and it can help out with your fatigue and your IBS. So even if you feel tired, have the discipline to work out, exercise every single day. I will tell you, it's going to make such a big difference in your life and make you feel so much better as well. Tracy, thank you for watching from Detroit. LaShonda, thank you for watching. Do I have an IBS course? Oh, LaShonda, I like that because it's coming up. We actually are in the development of an IBS course. If you want to learn more, subscribe to my newsletter and also subscribe to my Facebook and my social media streams. I have this coming up soon. Stephanie, thank you for watching from Australia as well. Crocus Flower, thank you for watching as well. Thank you guys for watching on the live stream. All right. Question number 2. Now, if you're joining me again, once again, I'm Dr. Islam, and yes, I'm a poop doctor. Let me know if you're watching this live or on the replay, and also let me know where you're watching this at. I love to hear where my audience is. And if you can also let me know if you're watching on Facebook or YouTube, because I want to make sure the technology that wasn't working 2 weeks ago is working now. But topic number 2, hey, Dr. Islam, are diet pills safe? So let me know in the comments, have you used diet pills? Do you know somebody who has used diet pills? What has their experience been with that? And I will tell you, in general, diet pills typically are not that safe unless you have them prescribed. They have their own side effects. But if you have diet pills you're getting from a over-the-counter or maybe a natural doctor, unfortunately, they typically don't work. And unfortunately, a lot of them are not very safe. They're not undergoing any type of rigorous testing. They're not undergoing any clinical trials. And basically, if you have a medication that doesn't go through that, anyone out on the streets can say this is going to work. They can claim anything they want. And I've had to send patients for a liver transplant because their liver shot down when it came to diet pills. Now, there's also a secondary to this, which is prescription pills, because prescription pills actually do go vigorous testing. It actually does go through clinical trials, and we actually could have evidence for that. And these diet pills typically are safe, but they have their own side effects as well. They can commonly cause gut issues when it comes to pain, diarrhea, constipation, and nausea as well. And this can cause people to have some other issues. But overall, diet pills don't really work that well when it comes to weight loss. At most, you may lose about 5% of your body weight. So what are you to do to lose weight? Here are my tips on what I recommend, and I will tell you that this really does help out when it comes to weight loss for my patients. Number 1, I want you to be proactive when it comes to weight loss. What do I mean? Too many of us are reactive. We eat something bad, we're like, I'm not going to do that again. Or we go through the holidays and we eat whatever we want, and then come January, we're like, I'm going to have a resolution to not eat bad like I did before. I don't want you to have a reactive mindset. I want you to have a proactive mindset. I want you to take the initiative to get ahead of the game, to put in steps to allow you to lose weight. Number 2, partners help. Yes, getting a coach, joining Weight Watchers, joining a class, having your husband or wife, having a partner help makes a difference. This is why these programs work, because it's the partnership, the community that you develop that will allow you to help you to lose that weight. Number 3, I would not recommend for you to eat all the way until you're full. The best way I recommend is that we have a gauge of 1 to 5, where 1 is where you're starving and 5 is where you're famished, you can't eat anymore. I want you to eat at a 3, where you still have some hunger, but you're not completely full, but you feel satisfied. And if you can fill the vast majority of your food with water and good whole foods, this is going to help out. Which brings me to my next point. Eat whole variety of foods with lots of fiber. This is why whole foods work, because they take up a lot of space, they have a lot of nutrition, and they have low calories. This is why people lose weight on these diets that are very whole-based type diets. And this is why this is going to be a more lasting way for you to lose weight. And then lastly, exercise helps, but unfortunately it doesn't play a big of a role as what we would like to do. You can add on extra calorie loss, but it really comes down to what you're eating. You know, abs are made in the kitchen. I don't know if you heard that particular saying, but it's so true. And if you do these steps, it's simple, but it's effective, but it takes a long time to work. But if you do this, it will help out and also allow you to lose weight. But diet pills, even the ones that are prescribed don't really typically do the best. Cindy, thank you for watching from Canada. Hope it's not too cold. Jeanette, thank you for watching. Kayla, thank you for watching as well. Shiraz, thank you for watching on the live stream. Jeanette, thank you for watching from Clovis. LaShonda, I think I answered your question. Thank you guys for watching on the live stream as well. And if you have a question for me as well, please let me know in the comments if there's any question you want me to do. All right, perfect. All right, so last question. Hey, Dr. Islam, I am drinking Bulletproof coffee. What are my thoughts? Do I think this is a good idea? And would I recommend this? All right, so let me know in the comments down below if you happen to have tried Bulletproof coffee or if you know what it is, because I used to drink it. It was okay, but I'll tell you exactly what I think and what the science shows. So what exactly is the Bulletproof coffee? So you may have seen ads for this. This is a big thing a couple of years ago. I think a lot of people are still doing it, especially those that are high in the keto diet. Basically, what you're doing is you're adding butter or ghee to black coffee or tea. And it's got really popular recently here in the US, but it's been around for a long time in South Asia and Southeast Asia, including Nepal, the Himalayas, and India as well. And basically what you're doing, you're adding butter, MCT oil to coffee, and the idea is that it actually switches you to more of a ketogenic state where you go into ketosis, very similar to the keto diet. And the idea is that because you're having all of that butter or ghee or MCT oil, it can help out with weight loss, keeping you fuller longer, help out with mental clarity, and also help you with ketosis. So these are kind of the thoughts behind Bulletproof coffee and why it's become so popular, because a lot of people had a lot of benefit with this. And I have seen patients and friends of mine who really feel like that they've had a good benefit with this. So what does the science say? Well, unfortunately, we don't have a lot of evidence that Bulletproof coffee actually does what it claims to do. We don't have evidence that actually brings you weight loss. We don't have evidence that actually brings you mental clarity. We don't have any evidence that'll actually keep you fuller longer. Here's what we do know. When you add that much butter or ghee to coffee, you make black coffee, which is virtually 0 calories, to as high as maybe even 500 calories for that particular food or that meal. So you're drinking coffee, you're having a liquid drink that's almost 500 calories in terms of how much you have. Now, that butter and ghee should probably make you fuller, but the problem is your body typically does not get full or feel fullness by just drinking liquids. It's very difficult to feel full by drinking in your calories. This is why we always recommend to eat your calories as opposed to drinking your calories. So if you have Bulletproof coffee, you're taking that 500 calories and you're hungry for lunch, well, guess what? You may be already very quickly over the caloric content that you should be having for that particular day. Now, if Bulletproof coffee keeps you full throughout the whole day, well, that kind of makes sense, and you're not taking as much calories. Number 2 is that you're adding so much saturated fat, and we know this is not a good idea. The type of fat that we want is unsaturated fat, and that saturated fat is the type of fat that can lead to heart problems and other issues long term as well. My recommendation, if you want the best type of coffee to help out with your liver, with your gut, with your microbiome, with inflammation, Alzheimer's, and mental clarity, black coffee. That's it. That's the magic bullet. Have black coffee without anything in there. That's going to be it. And that is what we typically recommend when it comes to weight loss, intermittent fasting, when it comes to having the best thing. That is what I recommend. That is what I do. Black coffee is my go-to. I recommend this. It works. It's fantastic. And we have excellent evidence that black coffee tends to have the medical and the weight loss benefit that other coffees are hoping to get. Jekyll and Hyde, go ahead and ask me a question. I think you had a question that you want to ask me, so no problem at all. So Shiraz asks, is pure clarified butter good for health? Why? It's a good question, Shiraz. I'll tell you, I don't think we know the answer to that because it's butter and butter is butter. And I'm not sure, anything that you have that has a lot of unsaturated fat, may not be good for you. And if you douse that butter with a whole bunch of French fries, well, I can tell you that's not going to be good for you. It really depends on the context in which you're having to have that. All right. Andrew has a very good question. A gastric bypass makes you fuller faster, which significantly reduce caloric intake and less food than intermittent fasting work as well. Well, if I'm understanding your question correctly, Andrew, I think the answer is yes. So when you have gastric bypass, what you're essentially doing is that you're removing part of your stomach. So you're not eating as much as you typically do because you only have so much room in your stomach. Very similar intermittent fasting where you're not taking in as much calories. The concepts are the same. Now, obviously with gastric bypass, you're removing part of the stomach so you can't actually physically eat more food. Or if you do, you're going to get sick. Whereas with intermittent fasting, you're actually not ingesting as much calories, but the outcome pretty much is the same. But with gastric bypass, because of the surgery, you have pretty much only a window of what you can eat, because if you eat beyond that window, you're going to feel it and your gut will feel it as well. Good question. So Bailey's and Ice asks, what causes yellow poop with discomfort and bloating? So when you have yellow poop, it's a good question. I love poop questions. I love poop color questions. I have a video on my Facebook and YouTube page that you can go to about this, but yellow poop can mean a couple things. Number one, if you eat food that's yellow, well, it's going to come out yellow. Number two is that sometimes if you've had bile, that bile will come off as yellow poop. So bile is a substance that our liver forms and it's stored in our gallbladder. Sometimes if your gallbladder works too well, bile can go into your colon to turn yellow, or if you've had your gallbladder removed, it can turn yellow as well. The important thing about yellow stool is that it's very normal. Typically, there's nothing to worry about. And it's typically something that I don't worry about as a GI doctor as well. So great question. I love poop color questions. I have a lot of videos on that. So Cindy asks, isn't coffee bad with acid reflux? Very good question. So let's talk about foods and acid reflux, because this is a very important point. So we know foods are out there that can make reflux symptoms worse in some individuals. Coffee, chocolate, tomatoes, processed foods, carbonated drinks, alcohol. Unfortunately, it's all the foods that we enjoy in life. But when you look at the science of food and reflux, it's really not that great. Meaning, I would not recommend in general a type of anti-reflux diet because we have no evidence that that type of diet will help out. Now, for some people, avoiding certain foods individually may help out. So for me, example, I suffer from acid reflux. I have it bad. I'm on medications for that. Coffee, not a big deal. I can take coffee. I am perfectly fine. Chocolate, not a big deal. What gives me reflux is meat. And I know that if I have meat, I will have acid reflux. So for me individually, I avoid meat. But in general, coffee has been shown in some individuals to make acid reflux worse. But as a general recommendation, it's hard to make that. Better things you can do, lifestyle changes, these work. Losing weight, avoiding late night meals, elevating the head of the bed, deep breathing, diaphragmatic breathing when you have reflux. These things actually work better than some lifestyle changes, than some food changes you may want to consider. Great question. All right, it's a good question here. Soderek asks, can I give some tips to treat hemorrhoids? All right, hemorrhoids, the bane of everyone's existence. Hemorrhoids suck. They're terrible. They're such a literal pain in the bottom. Here's what I recommend. Number one, If you are sitting for a long time or you're straining, that is why you're having hemorrhoids. You need to get that addressed, whether it's using a squatted potty, taking some fiber, adding some magnesium, maybe some Miralax, adding coffee. That'll help out with your bowel habits. Number two, if you can start to use some over-the-counter treatments, this will help temporarily. So things like witch hazel, preparation H, these work as a temporary options. Number three, you need to make sure your stools are soft. I would err on the side, I would err on the side of softer and looser stools as opposed to harder stools, allow things to flow through easier. These are temporary fixes when it comes to hemorrhoids, but once you have hemorrhoid issues, there's a very excellent chance you're going to come back. So luckily in our office, we can fix those hemorrhoids. It is quick, it's easy, it takes 10 seconds. It's a very effective procedure. If you want more information on this, I'm going to give you a teaser. Go to my YouTube page. I'll link a video so you can go learn more information, or you can easily see me. We'll get those hemorrhoids taken care of. But these are effective over-the-counter treatments I recommend. Lastly, sitz baths. They do work. Use them, use them, use them. All right, we have time for a couple more questions. All right, it's going through. So Tracy asks, can GERD cause heart palpitations? This is a good question. So reflux can cause a lot of conditions that may seem like heart related, hence the name heartburn. So burning in your chest, absolutely. Chest pain, absolutely. Sometimes you get anxious, absolutely. Whether it can cause palpitations directly, we don't have a good answer for that. Now, if you're feeling anxious because you're GERD, or your heartburn and then you get palpitations? Yes. If you're getting chest pain from your GERD and then you cause palpitations? Yes, but a direct connection, we don't have a lot of evidence that heartburn can cause a direct connection, but it may be a secondary connection based on some of the other symptoms that you're having as well. All right. All right. What do I think about this is a good question. What do I think about the herb senna? All right, so senna is a pretty effective laxative, and it works for some individuals. The problem with senna is that for some individuals, your colon can get used to it over time, meaning it actually can lose the effect of that. So I wouldn't say it's bad, but I would say that it can be habit forming. And sometimes we want to recommend other types of treatments when it comes to constipation, whether it's magnesium, which is not habit forming, whether it's Miralax, which for sure is not habit forming and works very effective. These things tend to work. And I use senna maybe as a second or third line rescue treatment, but I try to use other medications or treatments, especially fiber, which is great for your gut, for constipation as well. All right, guys. Well, I want to thank you guys so much. I appreciate you guys watching. If you have a question for me, comment down below. Let me know also if you're watching this live or on the replay so I can know where you're watching this on as well. If you haven't already, I want to thank you for watching. Don't forget to smash that like button. Like, share, and subscribe. And if you want more videos like you're watching today, don't forget to subscribe to my Facebook page, my YouTube page, and subscribe to my weekly newsletter where we get great tips and tricks like you're learning in today's video. I want to thank you for watching. And don't forget, guys, let's talk about poop. I want to thank you guys. Have a great and happy day. Thanks, guys. Take care.